All right. Hi, everybody. This is another Fireside Chat with the Columbia Barnard Association of Pre-Dental Students. Once again, I'm David, and today we're joined by two of the co-founders of Community Health Ed. So Jiancheng and Paul, would you mind introducing yourselves?
Sure, I can go first. So my name is Jiancheng, and I'm a fifth-year PharmD student at Massachusetts College of Pharmacy and Health Sciences in Boston. After my PharmD, I'm hoping to pursue a PhD, and ultimately in my career, hoping to pursue a career in academia as well as research.
My name is Paul Soden. I'm a senior in the College of Human Ecology at Cornell University, majoring in human biology. And I'm planning to attend medical school after college, but right before then, I'm doing research next year at Boston Children's Hospital on the role of cerebrospinal fluid in brain development.
Awesome, and thank you guys for coming and speaking with us about Community Health Ed, your nonprofit. So first off, what is Community Health Ed?
Did you want?
You can go first.
This is the perk of online meetings, but Community Health Ed was kind of developed like 2 years ago. We're kind of like the name stands itself, community health education, but it stands to kind of two parts. It's the 501c3 nonprofits that on one part we help to promote the medical writing opportunities and publications to college students who are perhaps interested in public health as well as interested in scientific or medical writing. On the other part, we're hoping to, since we have these writings that are generated and produced by college students, and we try our best to ensure the accuracy as well as the precise of these writings. So in turn, we're hoping to use and leverage these writings to and distribute to different clinics and health centers so that it serves its purpose for community health education.
So how did Community Health Ed start?
So it started, I actually met Paul in like an internship program, like I think like 1.5, 2 years ago. And we had this idea, of thinking we're both in an internship program, we're both involved in research, and we understand that, research requires a lot of like scientific writing. And these are one of the qualities that, when a student are to pursue graduate school or pursue medical school, these are one of the qualities that like the interview committees or the admissions offices, the offices like look for. So we thought that, at the start of it, we're thinking to maybe we can develop this platform and to people and are open to people, especially college students, they may be undergrad or graduate students who are interested in practicing their medical writing skills. And in turn, we have this platform that will be able to help them publish their works, which will be adding on to their professional profiles in like their CV or resume. So that was our intent at the start. And now we're shifting our focus more towards the way of the community health education part, which Paul will definitely talk about in next. And we're also hoping to, in our recent rounds of applications, we also recruited writing translators. So we're hoping to leverage this team of translators so that we're able to reach out to people who are experiencing barriers, and I mean barriers like cultural barriers, language barriers, and educational barriers, who may not be able to interpret the English language or other parts of like important health information through that mean.
And so it sounds like there's writers and then there's research as well. Are the students who are writing supposed to be the ones submitting their own research, or what does the breakdown of that look like?
Yeah, that's a great question. So primarily we have a team of student writers. Right now we're building that up. And we have we have different focuses, and I'll talk about this in a little more detail in a second, but we have several different focuses, including neurological disorders, dental health and medicine, psychiatric illnesses, cancer genomics, and each of those are, as we view, important public health areas that we can use community health education to try to promote education about. And so typically what student writers do is at the beginning of each month, our center directors, our section directors for each of the sections, will put together a list of different topics. And each of the topics should be based on a recent peer-reviewed paper that was very impactful in its findings, sort of seminal in its findings. And we ask our student writers to use those topic ideas that are generated by the section chairs as sort of a springboard. They can either write an article about that research paper that was published, or they can find a similar article that's still of interest to them and then write a reflective piece on that. And what we want in the pieces is for each of these articles to be in lay terms, which is a really good practical experience for aspiring doctors and aspiring graduate students to help them, conceptualize really complicated scientific ideas and boil them down into succinct, jargon-free ways of writing it. But then also it's a great way of actually reaching different communities and making literature that is really important and could help people make better personal health decisions and more informed personal health decisions. And it's a way of really getting that information to them.
Now, you just mentioned reaching out to communities. Community is part of the name of the organization. Who is the target audience of Community Health Ed? Who are you trying to reach, help, all of that kind of stuff?
Yeah, that's a great question. And so I guess before I say exactly who we're aiming at reaching, I guess I'll sort of talk a little bit about our objective and then how that objective ties into our target populations. So we're currently building our organization around the health objectives that were set out in Healthy People 2030. And for those of you who aren't familiar, at the beginning of each decade, several governmental agencies, including Health and Human Services, the NIH, Centers for Disease Control and Prevention, as well as independent agencies and several public health experts from around the country, convene to set public health goals that they believe that the American medical system should be striving to achieve within the next decade. And so this initiative is called Healthy People, and then whatever the name of the decade is. So last year in 2020, we made Healthy People 2030, the set of goals that we think we should be achieving by 2030. In 2010, they made Healthy People 2020. And these goals or objectives, as they call them, that were set in 2010 and in 2020, they generally aim to promote health equity and reduce socioeconomic disparities in health and disease, as well as sort of refocus the American medical system as an agent of disease prevention, rather than just relying on treatment and management of chronic illnesses. And so our goal, broadly speaking, is to leverage community health education to try to help achieve some of these lofty public health goals by the end of the decade. And it's important to recognize that in order to actually achieve some of these goals that are very ambitious, it's not enough just to educate patients or future patients about and make them more informed about how to make personal health decisions, but also it's really important to relay to future doctors and future healthcare providers about the important role that community health education and preventative medicine plays in our medical system. And so that's our primary mission, to improve public health by educating both future doctors and patients and identifying educational strategies that will work for both groups. And so given that, our target audience is primarily to target those who have been left behind by our medical system. And this is why we're primarily distributing our educational materials through primary care offices, and why we're trying to start this new initiative to translate our newsletters into other languages. And then we're going to strategically, through our new community outreach team, try to get specific newsletters about specific topics and in specific languages, and match those newsletters with communities that need them in a very targeted way.
That's great. And, you know, so going off of that, if someone were to, you know, look up community health ed, maybe we can have one of you share your screens. You can maybe walk us through the website, because I think that would be a good place to kind of maybe learn a little bit more and understand what community health ed has to offer, and also, you know, just gets a sense to everybody of what exactly is done in practice. So if either one of you wants to, or is, I think you should be able to.
Share screen of the website. Can you see the screen here? Or?
Yeah.
Yeah. So this is like our front page. And we're probably trying to renovate it. Add a little more content at the end of it. But at the start of it, we're just trying. So the homepage here, we're just trying to, you know, communicate a message here, and there's a button here, which users can click on to learn our missions and visions, and what we do as an organization. And here on the above us, we have our leadership team here. And if you were to click on Paul, there's a lot of information about Paul with his bio, as well as his the link to his LinkedIn, as well as there as well. And down here we have our board of advisors. So one thing to note is that, which is kind of cool, like a cool characteristic of our organization, is that all of us are students. So this is, as Paul said, we are a student-run organization, and we're really hoping to, you know, do this organization not only to promote community outreach, but also promote leadership qualities as well as medical writing qualities for college students, so that they can, you know, maybe get something out of it from us that can be beneficial to them. So that's also part of our goal as well, is to provide opportunities for college students. And here under the read, we have different sections. So we have COVID-19, which is brought at the top, but the other ones are alphabetically ordered, except for miscellaneous. So we also have cancer, dental health, genomics, medicine, neurological, and psychiatric, youth and college. So under each of these, for example, we have like the picture features, as well as if you click onto it, it's the entire student's article. So this one was written by a pre-med student at MCPHS University. And if someone is, you know, tired of reading like the whole text on the website, we also publish them in a PDF that is probably, I guess, more easily accessible, but as well that is more visually appealing. So, and then we have our monthly newsletters here. February is coming up to be posted, but it is done actually. So we post our monthly newsletters here. And if we were to click onto one of these, so it's one of the front page is always a little bit about us, and then what is inside, and then our team here, and then each of the individual articles that we have selected that are of very high quality, as well as with very relevant information pertinent to certain topics. And here is, so I'll go to the Get Involved page first. So there are 3 ways that we aimed at having students get involved with us. The first one is starting a chapter. So we're currently also hoping to, like, you know, convince and encourage students to start like a local chapters to in their own university as well. So in this tab here, in this page here, we have our handbook or guideline here and how they may be able to start one of the local chapters in their schools. So a little bit of who we are, and then like a welcome message. And here we have the operations and responsibilities of what a local chapter might expect when on like a annual or semester-based requirements, as well as like a mission and vision statement. So lastly, we also have the 5 e-board positions that we expect local chapters to have if they were to start one. And going back to, so these are just overlap informations that are in the handbook here. And going back to the page here, we post our available leadership positions on this page, and there is an application here that you can download along with a CV or resume to our email. So these are the positions that are currently being considered. We also are in review of some of the applications that are submitted to us as well. So this page here, as well as the positions here, will probably change very soon with the addition of like writing positions and others. And lastly, this one here is contribute as a writer. So this brings you to the submit an article page here, and it tells you how it works, or tells you what you can benefit from it. And here down here we have a writing guideline here. It tells you that how a student can get started in terms of hoping to contribute to us. So we have an existing list of writing topics, which Paul talked about earlier in regards to our section chairs being able to come up with writing topics on a monthly basis to facilitate the runnings and programmings of community health ed. And so once they choose a topic, they can either email us, or they have to use this submission form here, which takes it to a Google form, and it's just some relevant information about who they are and where they are from. And the last page we have here is the Contact Us page, which basically just displays the information about our emails. And we also have the Contact Us form that they can utilize as well. And these are also our social medias. So yeah, that's like a brief, like a rundown of our website.
Great, thank you for that. And now kind of, as you could see, my face was in there. So as somebody on the inside, a question that I think people might be interested in is, I know that we've had a lot of growth very rapidly, and we're continuing to grow. So can you tell us a bit about the growth trajectory that Community Health Ed has seen, and just maybe where you think that's going to be going and what your hopes are for that growth?
Yeah, definitely. So I've been on Community Health Ed now since the beginning for 2 years, and we've definitely had sort of an exponential growth curve at the beginning. We were mainly just trying to get writers. We were mainly trying to establish the credibility of our work, figure out procedures for, an editorial process, making topics for the different articles, and then also simultaneously trying to figure out how to distribute them. But we were mostly focused on building that student network of writers. And at first, because neither of us had started a non-for-profit before, or really had networked, at least I hadn't networked between college campuses, it mainly spread by word of mouth. I recruited my friends, Jiancheng recruited his friends, and our initial executive board members just recruited people who were in their majors and in their programs at their respective colleges, and people who we knew through internship programs. We met through an internship in Boston. And so that was it was perfect for the time. It wasn't the fastest growth trajectory at first because of that word of mouth aspect. But much more recently, we've established I think we have over 70 students at this point, representing over 25 to 30 different college campuses. And so at that point, earlier, I think in September, October, we were satisfied at that point with the number of writers that we had and the quality of the articles that we had. So we started to shift more towards the community outreach portion of community health ed, and also the promotion of education of future doctors point. And so how we did that was through, first of all, just reaching out to different clubs and organizations at different colleges, which definitely was hard at first, trying to figure out who to email, who to get in contact with. So definitely none of this has been like a linear pathway, but through reaching out to certain clubs and organizations, just through cold emails, people found out about us, got interested in our work, interested in distributing our newsletter, and also joining our team, as this is how we got involved with David and David joining our team. And so that at that point, we were ready to do an organizational shift to try to figure out how we can manage and streamline our writing efforts, our operational efforts, and then also our outreach efforts. So that's been sort of the exponential part of the curve. Over the last month, we've been doing recruitment we have a lot of different connections with different universities now. So we were able to send an application out through the administrators at several different universities, primarily on the East Coast. We haven't really broken into the West Coast yet, but and through that, we got a lot of applications for those 5 positions that you saw before. And now we're doing an interview process, and we are expecting in the next couple of weeks for our team to almost double in size. And for how it will look like is we'll have an operational team with all of the section chairs that I mentioned earlier, and sort of the executive leadership. We'll have a community outreach team whose sole focus is just doing community outreach, getting community health ed's educational materials into the correct and proper relevant primary care settings, and then also monitoring and evaluating the effectiveness of is what we're doing actually working as we're intending? And then finally, that writing team.
I just want to add a little bit. We're also looking to build on another part of our organization with events and workshops. And another one that is coming up, which is actually in early March, is that we're going to have a student leadership panel. And the panel is entitled Connecting Your Extracurriculars to Your Career Passion, and then a panel on student leadership. And in that panel, we were able to invite 4 different representatives of student leaders across 4 different health fields. So one is a MD PhD candidate at UCLA, who were previously a Churchill Scholar at Cambridge. We also have a PhD candidate who is a PhD candidate at Oxford, who's an NIH Oxford scholar, and we also have a pharmacy resident who has went through PGY1 and PGY2, practicing as a pharmacist as well as serving as an adjunct faculty in UCSF, and we also have a industry fellow who were very involved in his time when he was an undergrad and graduate as well, in various means of national organizations. So we're hoping to bring that leadership qualities to our student network as well within community health ed. And we're also hoping to come up with a lot of networking events or maybe guest speaking events, as well as workshops that can achieve our goals in this area.
That's awesome. And, I appreciate you guys going through everything in so much detail. It's definitely, speaking again as somebody kind of on the inside, it's definitely exciting to see how even since I joined, which wasn't too long ago, it was towards the beginning of the academic year, but things have really sped up quite a bit since then. So it's been great to watch and see. One thing I was just thinking, have it written down here, but can anybody write for community health ed? I know you showed a couple avenues to get involved. But besides sending some information about yourself, is there anything else that people should know if they want to get involved and write?
Yeah, that's a really great question. So right now, as we're doing sort of an organizational restructuring, we are currently putting together a writing application, and we welcome everyone who is interested to apply. Specifically, we're not going to have people just submit their resume and a writing sample, which will be, if we like the writing sample, it'll be your first publication for community health ed, and it'll be based on those topic lists that our section chairs create. And it's just to make sure that we want our educational materials to actually help. And so in accomplishing those two dual goals of getting educational materials out there and also helping students, we think it's beneficial to have that initial screening application process. But even for people who are interested, even if you're not the strongest writer, our goal is to help future doctors and future healthcare providers be effective health communicators. And so we'll work with you we have a medical writing coach and a fantastic editor-in-chief who works with our writers to try to, improve succinctness, which I've always had trouble with, improve like paring down certain, like choosing which biological concepts to talk about, because as people who are studying biology and research, sometimes we can get a little carried away with, oh, this is important, oh, we need to include this, but usually we don't. And our medical writing translator is really great at saying, you don't need this. And so our editorial process is definitely very interactive with that goal in mind of improving medical writing broadly with different students. And so to sign up to be a medical writer, currently we have an inquiry box on the website that Jiancheng showed. Just if you're interested, send us an email and we'll get back to you with more information about how to join and how to fill out the application.
Yeah, I just want to add that we're hoping to also inclusive of students in the graduate years. So these include like maybe if they're in graduate school and pursuing like a master's or a PhD. We recently are looking to have a MD candidate on board as well. And we have several PharmD candidates. So people, they don't have to be necessarily in the undergraduate years to be a writer. They can be, in their graduate years as well.
Yeah, we want to solicit diverse perspectives from everyone because, an undergrad who's pre-med definitely has very different experience than a PharmD candidate or a current medical student. And we think all of that is very helpful and beneficial to our educational materials.
Awesome. Now, I mean, if anybody has any questions, anybody who's here wants to ask a question, this would be a great time. But if not, there is definitely, a few ways that people can get in touch with you guys. I'll be sending around in our listserv your information. And then obviously through the website, there's also ways to get in touch with you guys. But if anybody has any questions, feel free to jump in. Or if there's anything you guys want to say that, I didn't ask or anything like that. Alrighty, well, thank you guys so much for stopping by and chatting with us about community health ed. This was really great and informative. We look forward to, I look forward to continue to work with you guys, and we look forward to hopefully having some more people, come on board and do some writing and getting involved. So thank you guys very much.
Great to be here. Thanks for inviting us.
Yeah, thank you for hosting us. Thank you so much.